We have our next presenting guest. It is Professor Bruno Renzi from Italy. He is a psychiatrist, former professor at University of Milano, faculty member at Maharishi International University in Iowa, co-director of Maharishi College for Perfect Health in Netherlands, and a director of Psychosomatic department in Maharishi University for Latin America and Caribe. Please welcome.
So, thank you.
Thank you.
Once again, I wish to thank Thomas and the organization team for this wonderful assembly. And my topics is Maharishi Ayurveda integrated approach to psychosomatics basic principles. And these topics refer to three main frame of reference, that is integrated medicine approach that is strongly emphasized from the WHO, Maharishi Ayurveda, that is a huge field of knowledge, and psychosomatics, that is a branch of psychiatry. So to speak of these things in 15 minutes is really difficult. So I decided just to present some basic principle regarding this integrated approach. And the purpose of this presentation is to define and present the main basic principle which form the frame of reference of Maharishi Ayurveda integrated approach to psychosomatics disorders, anxiety, and mild depression. In 2019, 301 million people worldwide lived with anxiety disorders. In the post-COVID period, estimates speak of 374 million people with an anxiety disorder that with an increase of 26%. In adults, depression is the most common mental health problem. 280 million lived with depressive disorders, including both major depressive disorders and dysthymia, which an increase of 28% after the pandemic. And normally, with anxiety depression, we have some somatoformal disorder, that is somatization disorders, conversion disorders, hypochondria, body dysmorphism disorder, algic disorders, and also undifferentiated somatization disorders. This is all psychosomatics disorders. And in the modern medicine, the treatment is normally simply pharmacological or psychopharmacological, or can be psychological treatments, different forms of psychotherapy, or integrated approach that can be psychological and pharmacological treatments. But this is very reductive if we want to treat from the holistic point of view a person. And so from the Ayurvedic point of view, I would like to start from definition of health, that is Vastya. Health is the state of health, is the result of equilibrium of dosha, agni, dhatu, and mala, and the condition of excellence, prasanna, of soul, sense, and mind. In modern medicine, the power of digestion, the tissue and the waste product and the condition of mind and sense are very well studied and very well known. What is completely missing is the concept of dosha, that is a primordial organizer of function and structure of our physiology, and at the same time, concept of soul. That is not, that we will see that soul now is not so metaphysical. We can have also some understanding about that. And the first basic principle is the paradigm of consciousness. As I said in the first day, consciousness, this paradigm is pervading different field of science, neuroscience, medicine, mathematics, genetics, everything now is connected with this paradigm. And consciousness, in its essential nature, is behind the brain and behind the individuality. It is the limitless pure being, the self of everything and everyone, the unified field. This is from Tony Nader, Professor Tony Nader, in his book, One Unbounded Ocean of Consciousness. Nothing is more intimate and central in the life of human being than our consciousness. It is a foundation of all our experience. It will be difficult, if not categorically impossible, to imagine an experience we could have without being conscious. All our perception, all our understandings, all our communication with others are based on consciousness. Thought, emotion, intuition, memory, planning, everything depends on consciousness. It is the one fundamental element underlying everything we think and do, everything we experience, both internally and in the world around us. And this is the paradigm of consciousness is very well explained from the scientific and philosophical point of view in this book that is the books of Professor Tony Snyder, that is One Unbounded Ocean of Consciousness. And I suggest you just to read this book, that is a really fundamental knowledge. And from the scientific point of view, we can understand consciousness as the unified field of all laws of nature. And this from this fundamental dimension, that everything in nature is expressed. So everything's on the level of quantum physics, on the level of biology and molecular biology like DNA, and all the aspect of our physiology is an expression of consciousness, is an expression of the unified field of all laws of nature. And it's very important that we need to be in contact with this our dimension, that is the inner self that organizes and organize all our activity and all our physiology in a perfect way. And the second principle is determinants of personality, factors that are the determinants of personality. And we can see that from the Ayurvedic point of view, we can see that it's underlying hereditary and also that the biological condition of the uterine of the mother, Ahara and Vyara of the mother, that means diet and behavior of the mother. Purva karma suritukala, that means the behavior of the mother associated with season, just right behavior with that peculiar season, and also the psychic state of the mother. There is some also postnatal aspect that is birth of place and times, but all these aspects are very well defined in modern science. What is completely missing in modern science is some preconceptual dimension that is related to consciousness, that is Atma, Purvajamna Krita Karma, that is some old memories that come from past lives, and also some psychological traits. All these aspects are conveyed from a unique integration of 5 protobhavas, that is 5 Tanmantras. So this aspect can be understood as a holographic dimension that governs the expression of the DNA in terms of constitutional type of constitutional psyche. So, and we can understand this also as morphogenetic fields. These morphogenetic fields are a new type of field, preside the formation of organisms and evolve, have a history, and thanks to the morphic resonance mechanism, they have a memory. They are part of a larger family of fields called morphic fields. It's this kind of fields that organize the expression of the DNA, also for regarding to the psychic constitutional in the individual. According to Sheldrakes, morphic fields are regions of influence within space-time, localized within and around the system that organize. Their operation is probabilistic. They are limited or imposed in order to the inherent indeterminism of the system which they preserve, include and connect the various parts of the system that they are intended to organize. And these morphogenetic fields are responsible for the psychic constitution from the Ayurvedic point of view. We know that normally what is emphasized in Ayurveda is doshic constitution or dhatus constitution. But if we want to understand very well the knowledge of our or just the nature and the structure of our patient, we have to integrate also this knowledge that are psychic constitution, and we have 7 sattvic constitution, 6 rajasic constitution, and 3 tamasic constitution. I can go all this through subjects because there is not much time, but I invited to you just to go and study all this aspect regarding the Ayurvedic psychic constitution. And the third principle is related to etiology. That is very important. If we want to understand psychosomatic disorder, we have to look also at the 7 disorder classification from the etiological point of view. So we have disease of genetic nature. I don't read the Indian Sanskrit terms, but I prefer to read only the English terms. So disease of genetic nature, errors in the mother's conduct, mental and physical dosha alteration, disorders related to seasonal changes, traumatic nature disorders, disorders related to the alteration of conduct and senescence, and disorders related to supernatural events. And also Charaka defines 3 causes of disease that are very important. That is asatmendriyartha samyoga, that is reduced or excessive or alterated use of the 5 sense and motor organs. My colleague just spoke about this. Dr. Gupta just spoke about this. Prajna parad, alterated use of mind and intelligence in the sense of lack of understanding or voluntary transgression to the loss of connection with consciousness, with our inner self. We need to be connected with our very important inner dimension. And then parimana, that is reduced or excessive of a normal incidence of seasons. And prajna parad is considered the ultimate cause of disease. Much emphasis is placed by Charaka on karma. In this sense, in the sense of present or past regarding the genesis of disease. So it's very important, exactly that morphogenetic fields that organize all the expression of the individuals from the DNA, starting from the DNA. And another basic principle is related to treatment methods, and we have different methods in Ayurveda just to treat psychosomatic disease. And normally, what is emphasized in the Western world is yuktibhya parsya, that is therapy based on the balance of dosha. That this is panchakarma, herbs, herbal products, diet, daily and seasonal routine, yoga. And in Maharishi Ayurveda, we have also Vedic sound therapy and marma therapy and light gem therapy that are very efficacious kind of treatment that we can use with our patient. But then we have to also pay attention to this Daiva Vyarshya, that is faith-based therapy, that is related to the Indian culture. It is not so allowed in the Western world, but it's a very important also aspect of the therapy for some patient. And Sattva Vajaya, that is psychological therapy. And this is normally is not taught in Ayurveda in the formation of the health practitioner in the Western world. And Sattva Vajaya, psychological therapy, it's a very important aspect because we see that very well explained in Ayurveda. Then we have a support psychotherapy. We have also Achara Rasayana, that are rules of conduct, and also the treatment of mental states that we need to treat emotional state, because if we don't treat this dimension, we don't have any change in our patient. And this is my experience. So it's very important that we go through all this aspect. And also there is some very important is jnana, spiritual knowledge, scientific knowledge, and also smriti, and we can treat through transcendental meditation and yoga. And the last principle, I don't go through this because I don't have time, but nature has a purpose, which is the evolution of life to higher states of consciousness. We have to guide our patient to realize these higher states of consciousness, because from when we stabilize this dimension, all the life of our patient, all our biology is very well balanced, and we go in an evolutionary kind of life. So thank you for listening, and thank you.
Thank you very much.
Okay.
Consciousness is beyond the brain and the individuality. Thank you so much, Professor Renzi, for presenting on such an incredibly profound topic. Thank you very much.